Hi, my name is Mackenzie Dillard, and I chose ADHD. I chose ADHD because I work in the school system, and at times I have children who have ADHD, and sometimes they really struggle. And I just want to have a better connection and concept of how it really does affect them. What is ADHD? ADHD stands for Attention Deficit Hyperactivity Disorder. By and large, it's the developmentally inappropriate frequency or severity of inattention, hyperactivity, and/or impulsivity. The hallmark criteria are inattention, hyperactivity, and impulsivity. There, there's no single cause of ADHD, but there is a fair amount of research supporting a genetic basis to ADHD. It tends to run in families. Children with ADHD demonstrate different brain structure than those without ADHD, which we know from neurological and neuropsychological studies that have been coming out in the last 10 to 20 years. And also prenatal exposure to toxic substances, nicotine, alcohol, and other drugs are associated with increased risk of ADHD. ADHD is largely a lifelong challenge, but it magnifies itself differently over time. How is ADHD identified? ADHD has been around for a very long time as a diagnostics category. Through the criteria for diagnosis have changed over time in the DSM, which is the Diagnostics and Statistical Manual of Mental Disorders. In addition to experiencing inattention, hyperactivity, and/or impulsivity, one is that the difficulties need to take place across two or more settings. Usually these settings include the home and the school, or the home and the workplace. Otherwise, this could be a situation or setting specific difficulties and not necessarily ADHD. At what age do you find ADHD to be most identified? I know from experience that ADHD can be seen in children as young as 5 and 6 years old. It really is in that adolescent and early childhood area where they experience it the most and when it's diagnosed more. Typically, the onset of ADHD is before age of 12. So symptoms should be present by this time. And some might ask, well, what about the adults who didn't find out they had ADHD until they were adults or later in life? However, there is what is called adult onset ADHD, which magnifies differently than childhood ADHD. But there's also folks who were not classified, diagnosed, misclassified, or diagnosed earlier on and may have had ADHD, which makes it a bit difficult to tease out the research. How common is it to have ADHD and a learning disability? I think everyone agrees that it is common for school-age students to have ADHD and some type of learning disability. And the reason for this high currency is that there's probably a shared genetic and underlying neurologically ADHD and LD. All students in K-12 may acquire academic skills differently because of ADHD behavior. Like they're not paying attention or they're hyperactive and those behaviors interfere with learning. Also, students with a learning disability may exhibit ADHD behaviors because they cannot understand the subject matter, or they're not motivated to learn because they have a learning problem, challenges, or disability. So they wander off, they drift, they're not paying attention, so then they may exhibit ADHD syndrome. Pure ADHD is rare. ADHD typically has other disorders along with it. Of course, we're talking about learning disorders and learning disabilities, but it can also occur with other behavior disorders. It can also occur with anxiety and depression. And going back to what I was talking about with children wandering in class and not being able to pay attention or learn, there's many accommodations that can be set in place through an IEP, which is a um, individual education plan, and we as educators follow that, and it's our job to make sure that they're getting what they need. And sometimes they get like extra time on assignments, or um, the instructions are tailored to a specific child to help them better understand, positive reinforcement and feedback. We have these things, they're called rubber band chairs, and it's like a rubber band you put around the bottom of the chair so they can bounce their legs without making noise and disrupting others. Um, Noise counseling headphones, that way they can stay focused. Um, Reminders, preferred seating where they sit closer to the teacher so the teacher can keep an eye on them, and other things as such. What are the treatments and accommodations for ADHD? The combination of stimulant medication, sometimes called pharmaceutical therapy, and a kind of behavior management teaching is the leading treatment, especially for school-age individuals. When there's a learning disability or disabilities, it can be best to target both the academic skill and the challenging behaviors at the same time, because that provides the highest probability for improvement in the academic and behavior domains. The disadvantage this combined approach is that it requires a lot of resources and intensive intervention. The more the intervention, the greater the possibility that the regimen won't be followed correctly. It's possible to target only the behavioral side or only the academic side, and there will be some generalized effects in the other domain. But I think if we can provide interventions on the behavioral and academic side at the same time with fidelity and with cooperation with family, then I think the prognosis is pretty good. What are some myths about ADHD? sugar, food, additives, and fluorescent lighting causes ADHD. I'm not sure you want to give a lot of sugar to a student who is hyperactive or impulsive, but it doesn't cause the disorder. There's no single cause of ADHD, but research supports that it tends to run in families that can be caused by prenatal exposure to toxic substances. That individuals with ADHD are acting out on purpose. ADHD is very clearly a self-regulatory disorder, and that has its roots in the individual's neurobiology and probably has genetics. So it's not like they're just choosing to not control it, misbehave, or are engaged in bad behavior. Individuals with ADHD need intervention to help control their behavior and alterate their symptoms. Does medication fix ADHD? It certainly doesn't. I think it's fair to say that when it comes to psychopharmacologically for children or students K through 12, that we have the largest research basis on stimulant medication as opposed to medication for anxiety or depression. Stimulants don't necessarily teach students with learning problems or anything, but what they do is help them to be more ready to learn. I am not a big fan of pharmaceutical for K through 12, but when it's needed, it's necessary and it's helpful. And there are positive side effects, like they're able to pay more attention, they have fewer behavior problems. I also think that you have to have a physician or a pediatric neurologist who understands the impact and influence the medication has on younger folks. So I hope that gives you all a better understanding of ADHD and how it can affect one and how it may be caused and the different accommodations that are available for those who do have ADHD within the classroom and possibly within college. Here is a list of my references. If you would like to go look at those, they have more information provided on these sites.